Okay. All right, we ready? All right, first off, I want to just thank everybody for coming out. This is not a protest. We're not here to protest anything. Our intent is to just get together and all as one go up to the congressman's office and ask him to please not vote for this because we do not want it. And so I find it very interesting and slightly humorous that they're afraid of that, and so they have organized an anti-protest to our non-protest. So aside from that, now I normally don't like to speak with any notes or papers, but there's a 2,000-page healthcare bill, so I want to make sure that I get some of the facts right on that. Basically, what we've got going on here is a government takeover of the healthcare system. Now, in essence, what that means practically is they're going to start taking away our choices, not adding new choices. It's too expensive. The administration has said it's $1 trillion over the next 10 years. In fact, it's going to be more like 2.3 trillion with a T over the next 10 years. It's too big. There's too many things in it, and it's too complicated to pass in a knee-jerk type reaction. We should take some time to think about this. Common sense tells you that you need to know what you're voting on before you vote for it. And Congresswoman Pelosi a week and a half ago flat out said, well, we need to pass it to then tell the American people what it is that we're passing. That defies common sense and logic to me. It's going to cause more harm than good, flat out. It's going to raise taxes excessively, especially to those that are paying in substantially. And did you know, I found this very interesting because I didn't know. But what we've got going on is they're now inserting education issues into this healthcare bill. Sallie Mae is going to have to cut a third of its jobs nationwide. A quarter of those are right here in Indianapolis, Indiana. Fishers, more specifically. And we've got folks that live in the 7th District that are going to get laid off from working in Fishers because of this. Why do we need education issues in the healthcare bill? We do not. What we need to do is we need to start looking at it with some common sense. We need to actually make changes that are needed, and we need to clean up the current bill that we've got going on right now. We need to work, obviously, to expand coverage to the uninsured and underinsured, but we must do it responsibly and affordably. Now, we deserve an up or down vote on this by the U.S. House of Representatives. It's just that simple. It is unfortunate that the only Indiana congressman, our congressman, that has already said yes, he's going to vote for this is Andre Carson, and he has done this before we even have a final bill. How can you say, yes, I'm going to vote for something when we don't even have a final bill? Now, we need better representation, but more than that, we deserve better representation. I'm going to go through a few points as why this is bad for Indiana. First, massive expansion of Medicaid. One out of every 4 Hoosiers is going to be now on public assistance. The hugely popular and highly successful HIP program, Healthy Indiana Plan, that'll get eliminated. Many Hoosiers are now going to start to pay higher premiums, about $2,100 for most families. And worse, it's going to do a job-killing tax of about $2,000. That's not good. A couple other facts. Only about a third of Americans agree with this current incarnation of the bill. That means 2/3 don't. Who are the people listening to? Or, I'm sorry, who are the congressional leaders listening to? I don't think it's the people. And now, just as a slight little aside note, we've got about a dozen Democrat congressmen that are saying they're not going to vote for this unless it incorporates a tougher firewall, tougher safeguards against taxpayer-subsidized abortion. Now, a lot of folks on the Democrat side are saying, well, you're just the party of no. I'm not the party of no. I've given you the reasons why I don't agree with this, but I'm going to give you now a starting point as to what we can do. First is choice and coverage for all. Keep current employer-sponsored coverage if you like it. Current employer plans should not be taxed to pay for the government takeover healthcare bill. Another thing we could do is pooling mechanisms and group plans for everybody. Basically, Americans should be able to choose from a number of different group plans. This will make healthcare more affordable and, more importantly, more portable if you choose to move from state to state. Another item is control costs, cover pre-existing conditions and chronic conditions affordably. Now, Indiana is a model for consumer-driven healthcare. What we've got is the Health Savings Account, HSA. HSAs encourage patients to be wise consumers of healthcare. And no American should go bankrupt because they're sick or because they have emergency medical issues. or they shouldn't be denied coverage just because of a pre-existing condition. I've got one staffer on my campaign, a full-time staffer, who has over $250,000 in emergency medical health care bills. That's not something that is very good. Now, the sick and those with chronic conditions, if we start to look at these starting points, we'll be able to pay and buy coverage at competitive rates. That's one of the most important factors. You've got to be able to pay for it, you've got to be able to afford it. How can we provide health care and quality health care efficiently? Well, suppliers need to start looking at this. Doctors and other health care providers need to have some incentives to do this. There was a recent report come out that 45% of doctors will either choose to retire or not practice medicine anymore because of this. That's unfortunate. That's definitely not going to aid in healthcare. We need the rapid adoption of healthcare records and health exchanges. That way, when you go from doctor to doctor, state to state, you immediately have access to your records. Now, this is going to potentially have the potential to dramatically lower long-term costs of healthcare, and at the same time, it's going to produce better outcomes. I've got more specifics in that, but I just wanted to give you the generalities. Now, to close off, these reforms are obviously just a start. They're not the final solution. But the journey of 1,000 miles starts with a single step. You have to start somewhere before you get to the end. Now, unlike the current bill, which the Congressman supports, I believe that my starting points will lead to responsible and affordable health care plans. We should definitely not be rushing through this. We should take our time. Something that is going to affect trillions of dollars of our economy and the next 50 years of our nation should be looked at, not in a knee-jerk reaction, but in a long-term view. Now, we basically need to fix this bill. That is very true. But again, we need to have some common sense inserted into this. So that's all the comments I've got. What we're here to do again is to just peaceably assemble. This is not a protest. Again, I find it interesting that they are having an anti-protest to our non-protest. So what we're going to do now is we're just going to go to the Congressman's office. I'm going to deliver my letter as his constituent that I do not want him to vote for this. We're each going to deliver our own letters and just tell him in our own words why we do not want him to vote for this. So I thank you all for coming out. I thank certainly the folks here for coming out. As you can see, it's just concerned citizens. I don't know why they're so afraid of some concerned citizens voicing their opinions. So with that, I thank you for your time, and we're going to take off all this stuff, and we're going to go in and let them know what we're going to do. Thank you.
Great. Thank you, Carlos.
Thank you, everybody. Have a good day.